them could be real humdingers. Charlie and Naga.
It's a good word, Carol. Thanks so much.
So let's talk a little more about those heat warnings. The yellow heat health alert issued for parts of England this weekend as temperatures are predicted, as Carol was saying, to hit 30 degrees.
So the warning, as you saw, covers London, the Midlands, large swathes of eastern and southern England. And all of this is part of the new alert system by the UK Health Security Agency and the Met Office. It's aimed at reducing illness and deaths amongst the most vulnerable.
So let's take you through the details. There are 4 alert colours: green indicating no risk to health, yellow, which is the warning for this weekend, meaning that heat could affect vulnerable and those with an underlying health condition. Amber means the impact could affect the wider population, likely to be felt across the whole health service. And the most severe, that is red, means a significant risk to life, even for healthy people, with a severe impact across all sectors to be expected. That is not what we're expecting this weekend.
No, we're at yellow,
yes.
the second one down. So let's talk to one of our regular GPs, Dr. Fari Ahmad. Good to see you. Good morning.
Morning.
So let's make it very clear. You are here not to give us more weather information, but to tell us how to cope in the heat. And the reason these alerts have been established is to protect the vulnerable, the most vulnerable. So we're at yellow. That could mean, I mean, as Carol said, temperatures of 30 degrees, 29 degrees in certain areas. How do you cope? What should we be thinking about today, actually, on Thursday, ahead of the weekend?
OK, so I think it's good to be prepared. I think that's important. So if you do know people who could be vulnerable, so, you know, people who are older, younger children, people who are on lots of medications, heart conditions, chest conditions, look out for them or help them look out for themselves. So hydrate. Make sure you drink plenty. So you're aiming to get your urine, your pee, like a light straw colour. And if you're doing that, you're drinking enough. Stay out of the sun when it's really hot. So, you know, between 11 and 3, try not to go out. If you're in a room where the sun comes in, put your blinds down, put your curtains down. You make sure you're looking after other people as well as yourself. So those are like all just simple, sensible things we can all do.
But also things, I suppose, like cold towels, you know, flannels in the freezer, you know, if you can, or in the fridge, or cold water so you can, you know, to lay around your neck. Those are things you can do to prepare ahead of time as well. Because sometimes the heat can just be such a shock because we're not used to it here.
No, we're not. And actually, the sun comes out and everybody goes, oh, wonderful, let's get out there. And if you look at how people live in warmer countries, that's not what they do. When the sun comes out, they're actually indoors or they're in the shade. And I think it's just being sensible in kind of following what they do.
When these heat health alert, the system was announced, part of what they were saying was it's very much for you, actually, the medical profession. So you have early warning as well. So do you proactively, you know your patients, don't you? You know the elderly patients, you know the ones who have maybe breathing difficulties. Is part of this that you proactively talk to people in order that they know that they're a potential risk to their health?
Yeah, so I guess that's part of why I'm here. I think we're talking to lots of people. I would love for the NHS and the health system to have that capacity where I could just reach out to everybody and say, look, we're hitting some warm days, make sure you've got, you know, enough cold fluids and you're looking at the moment where the capacity that we're running at, we don't have that ability. But I think that would be ideal.
Well, that's a very honest answer, because obviously there are people for whom there are more risks than others.
Yes.
Give us a sense of what groups there are, because breathing is one of the things. We were actually talking, I think, one of the key issues around this coming weekend, and the temperatures are not exceptional yet, but it's going to be hot at night, isn't it? Quite a bit hotter than normal at night, and that's significant itself, isn't it?
Yeah, so usually it gets cooler at night and people get a chance to cool down, but if you're still warm, if you're warm at night as well, you're not going to get that break in the system. I think there are, you know, services and people are informed. When you're older, so you're like over 75, if you're on multiple medications to help with your heart or your blood pressure, if you need, you know, stuff to help you breathe, you are more vulnerable to temperature changes. It puts a bigger strain on your heart. So you have to look after yourself a bit more and get people who look after you to be aware of it too.
Rather selfishly, I do think about this because there's this pollen bomb. I don't know if you have hay fever, Charlie. I have hay fever, and this is coming as well. So I just wonder, so many people, if you're used to hay fever, it's fine because you kind of get used to taking tablets or the spray. If you're not and it's all of a sudden hitting you, what signs should you look out for and what can you do about it?
So hay fever, you sneeze, your eyes stream, you can get a stuffy nose, some people get headaches, feel a bit tired. You're right, most hay fever sufferers already know the pollen count's rising. And if you take your meds and your pharmacist is your friend, there's lots of stuff you can take, and you can take tablets, sprays, drops, a combination, and it'll work. So make sure you've got your medication and you take it. If you're not sure what's going on, have a chat with your pharmacist. They can always get you to see your GP if what they're trying isn't doing what we need.
Sometimes it's hard to work out whether if you haven't routinely suffered from hay fever in the past, sometimes you think maybe I've got a bit of a cold.
Yes.
But it can kick in, the kind of hay fever. It happens at different times in your life.
Certainly. And we're seeing people who might not have had it when they were younger develop it as they get older. I think the thing to remember is if you actually get a fever, then it's not hay fever. If it's a fever, it's probably an infection. So that's one of the ways to tell.
Thank you very much. Good to see you here this morning.
Thank you.
Good to be here.